Shin splint. It's one of the most annoying running injury because it always comes at the worst timing. In your peak training, when you're feeling strong, when you're feeling the impact of your good training, you're getting faster, you're running longer, and now you have this running injury. So what should you do? Should you push through the pain or should you rest? In this video, I'm going to talk about shin splint, what it is, what are the probable cause, and more importantly, what should you do to get back to running as soon as possible? So should you listen to this video if you don't have shin splint right now? Yeah, you absolutely should. And I'm sorry if you do have shin splint right now. I know it is painful. It's never fun to be injured. Even if it's a mild case, it's very frustrating. If you don't have shin splint, I think these things, a lot of them are prevention that if you follow, you might not have to deal with that kind of injury, hopefully, and saving yourself some trouble. Hi, Simon here. Welcome to my channel. On this channel, you'll find running tips, no-nonsense running tips that have been tried and tested. I have more than 60 100-mile ultra marathon along with races of all distances, and these tips will be applicable whether you're running your first 5K or you're training for a 200-miler. Over the years, I've accumulated thousands of miles, actually tens of thousands of miles, and a few dents along the way. But you learn from your mistakes, and I have come with two fundamental wisdom of running. The first one is that most running injury can be prevented, or at least the impact can be minimized. The second wisdom, which sounds a little contradictory, is that no matter what you do, you will be injured as a runner at some point, and knowing what to do is super important. And that's why we're going to talk about shin splint today, because it is one of the most frustrating injury, but also one of the most common. And if you know what you're doing, if you're dealing with it quickly and swiftly, it can be just a little bump along the way, a couple of weeks, and then you're back to normal. But if you do the wrong things, you can make it worse and worse and worse, and it can last for months, and it can totally derail your training and your goal for this year. So what is shin splint? So shin splint, the medical term is medial tibial stress syndrome, MTSS. I know what I'm talking about. And one of the things that I will mention with all of my running injury, I'm not a doctor, I'm not a physiotherapist. I'm a runner with a lot of experience, but sometimes it's worth consulting, and we'll talk about that a little bit later. So don't substitute what I'm saying right now to medical advice, but I do think that MTSS, as they call it, is something that most of the time when it's a mild to moderate case, you don't necessarily need to consult. We'll talk about red flags that signal that, yeah, you actually should consult a physician or a PT, but 90% of the time, actually, if you are just a little bit smart about it or not stupid, as I like to say, it will be fine. And what is it exactly? Well, it's a lot of stress and damage that will happen along the shins bone, and it's not a stress fracture, it's not a fracture, but it is damage and inflammation. And of course, what comes with that is sensitivity, it's pain. The times I've had it, and for me that was much more common when I was really ramping up my mileage and getting into ultra running or running my first 100-miler, it can be extremely painful. It can be to the point when the slightest touch just hurts. I remember if Nora by accident would touch my leg, I would just kind of wince because it was just that sensitive. And usually that means that's a pretty severe case, but you can have milder case. And a telltale sign that it is indeed shin splint is that shin splint is associated to volume. So if you go on a run, it will progressively get worse and it will be painful after the run. Whereas if you rest, it should be much less painful. Also, the pain usually, but not necessarily, it's a little bit more diffuse. And that's a comparison to the red flag we'll talk about later, where if you have a stress fracture or an actual fracture, I remember breaking my arm with a couple of ribs. I was thinking, I don't think this is broken, but if it is broken, it would be right here. And yeah, the x-ray was like, yeah, it is indeed right here. So you can locate the pain much better with the fracture. And what caused this damage is exercise, it's impact, it's repetitive motion, it's the classic overuse injury. And we'll talk about the specific as to what you might have done that might have caused that. But the reason I insist so much on that before telling you what you should do, it's because, and the analogy I will give here is, If I tell you I'm wet and I'm cold, you might say, well, here's a blanket. But I'm like, well, actually, it's because I'm drowning in the ocean. The first step is not to give me a blanket. The first step is to get out of the water and then maybe give me a blanket or a towel afterwards. So don't forget to bring a towel. But the first thing to do is get out of the water. And in this case, the first thing to do is to resolve what has actually led to shin splint. And so the most common source or reason why you have shin splint is increased volume. We say, the 10% rule where your training plan should not increase by more than 10% per week. But that's really just like a kind of rule of thumb that is more applicable at certain distance. But once you reach the limit of what your body is capable of doing, and everyone will have a different weekly mileage where that happens. But for me, for example, if I'm around 80 miles a week, increasing by 10% is absolutely not. That is not going to go well, and I'm going to have injuries. That's where I need to ramp up very slowly. So knowing yourself will be important. Increasing gradually. And what that means is if now you had a training plan you were following, even if it was a good training plan, it's a shot in the dark to some extent. And next time you reach that mileage, maybe try to go a little slower. The second most common reason, and for me, that's the one that is most often the issue, it's not necessarily an increase in volume, but it is an increase in the intensity. So the speed work, all the interval, threshold run, if I do too much of that too quickly, because maybe I'm training specifically to run a fast marathon, which is something that I rarely do, that will often lead to shin splint, which is where I need to dial down the speed a little bit. Related to the speed work and the impact, it is an overuse injury where you have too much repetitive high impact. So yeah, the amount of running that you do, the intensity, but also the impact itself. So if you transition to a different terrain, or maybe you were doing more run on dirt and now you switch to pavement, or for example, you're running on the treadmill and then you switch to pavement because the summer just arrived, that could be a factor. Another key one that I say you should have a look and ask yourself is how much have you ran in your shoes? Shoes have cushioning, and I'm not necessarily a big fan of the huge cushioning, but I'm definitely not a big supporter of the minimalist shoes. There's a nice in between. Regardless of what you're using, when your shoes start to be worn out a little bit, it'll increase the impact and increase the likelihood of having injury, in particular shin splint. Myself, that has been the issue before, where I noticed, actually, like, I have a very mild case that is developing. It so happened that my shoes are really old. I switched them and almost automatically the problem is solved. So look at these factors: increase mileage rapidly, increase intensity of these workouts, the surface that you're running on, your running shoes. If none of these common culprit, you have nothing to say, you've been pretty standard, then you can look into other things. Sometimes we'll talk about bad running mechanic. Usually that's not something that would come out of the blue, but it's worth kind of filming yourself potentially on the treadmill and looking at how do you land. There's a higher likelihood, they say, with heel striking to have shin splint. Myself, if I run slow, I'm a heel striker. If I run faster, I'm much more of a midsole strike. So I can't really comment, but that's what people say. So worth mentioning it. All right, so it's great to know what you did wrong. Thank you, Simon. I'm already married. My wife is telling me what I do wrong all the time. You don't need to tell me. I'm telling you these things because you need to resolve them, but also the treatment and how you will approach it will vary slightly based on that. So know what is the most likely cause, and that will also prevent you from potentially heading in the same direction next time and be a little bit more vigilant about it. So the first thing that you should do to treat it, you don't necessarily need to absolutely stop running. In fact, myself, I would recommend to not do that unless it's an extremely severe case, but hopefully you're looking at this video before it gets to extreme severity and you're more in the mild to moderate situation. If that's the case, what I do myself, I reduce the mileage to maybe half of what I'm doing. And if you're familiar with my channel and the training plan that I've provided, usually I have 3-week cycle of high mileage, 1 week of recovery, which is half mileage. So basically what I do is I go directly to these half mileage week, and I will do 1, 2, or 3 weeks of that and monitor the progress. Monitor that it is indeed getting better. If it's not getting better through rest, that's where you should probably consult, but we'll have a section about that later. So half mileage, absolutely no speed work anymore. It's only to maintain your volume. And the reason I recommend still running on it if it's possible and not too painful. So you have to listen to yourself. And if it's getting worse from that, don't do it. But if you're able to do it and not feel worse and you feel improvement through that, it will help you maintain that mileage to some extent, because it is the balance that we're trying to have that is unfortunately very difficult, and that's why shin splint is so annoying. The best thing you could do to resolve it would be to not run at all and never run ever again. However, you are probably training for a race and you probably try to aim for a certain weekly mileage. If you rest for too long, you will at some point lose a little bit of that progress. So that in-between approach where you listen to yourself is probably the best approach. That's what's worked great for me, and within 2-3 weeks, it's kind of resolved. But don't get back to it too quickly. The pain might be better and you feel like you can go to full training. If you get back to it too quickly, what you're going to have is, sure, like it's only mild case, moderate case, but it's recurring. You always have it coming back and coming back and coming back. So that's where you need to be mindful. Rest maybe one more week than you think to be on the safe side, and that will actually save you a lot of time in your training as opposed to having another episode in 1 month or 2 months. The other thing is, look at your training. How did it increase in intensity or in volume just leading to this injury, and change that training plan. Adjust it so that it's a little slower to ramp up. Are you reaching your full potential? I mean, I don't know the mileage you're doing right now, so it's impossible to say. But what I would say is that I had the impression myself that I couldn't do more than 50 miles a week at some point, because I had a recurring issue with MTSS, but it's because I was not recovering well enough. Once I rest sufficiently and I wouldn't have these recurring problems and I adjust my training plan, now I can do 70 miles, no problem, 80 miles. That's where actually I'm reaching my full potential, where injuries are much more common. But to treat shin splint, it's not just about reduced mileage. The other thing that you should do, and you should be honest with yourself, is, do you have strength training session? I have a video about that. I think I'm going to make a new one in the future. But specifically for that, you need to reinforce your calves. You need to reinforce your anterior tibialis. And the exercise I would recommend for that, high level, I think calf raises are great for that. I think one leg balance is great for that. Close your eyes, it's making it much harder. So you're really using the stabilization muscle. The next aspect is, think about your shoes, especially if you've noticed, like I said, that actually, you're right, I have been using these shoes for a very, very long time and switching it helped. What you can do further than just switching them is use your shoes smartly. So have a rotation of shoes. Don't use every single day the same shoes. And also, at least the way I do it myself, maybe it's complicated, but once I receive new shoes, and for the channel, I test a lot of different shoes. So first, I just go for a small run with them to make sure that they actually fit me well. But as soon as I think, yep, these shoes are good, I use them for speed work, and specifically interval and threshold run, that the high impact, because that's when the shoes are still the best. Then I'll rotate them to my long run shoes, and then eventually they become more my kind of recovery shoes, and then they retire and they are my walking around shoes if they look good. I know it sounds complex, and it can even sound like, oh, now I need to have 5,000 pair of shoes. Not really, because at the end of the day, if you run 1,000 mile and you use on average your shoes for 200 mile, which, I mean, you can do more than that, that's 5 pairs. It doesn't matter if you do them sequentially, 200 mile, 200 mile, 200 mile, or if you do 10 mile here, 10 mile there. You can also use apps to track the amount of running that you do on your shoes. Strava in particular, you can create new shoes, and then each workout you put it. It's a little manual, but I was doing that at first, especially when I was solving my my issue with a shin splint, and it was super helpful. Now I kind of do it, I estimate it a little bit more, but it is a good step to take, because you will notice the difference, the level of impact that you feel. And it's true for shin splint, but it will also be true for heel if you have problem with your heels. And then the last few tips that I've heard myself, I'm not doing that for various reasons, not because I think it's bad, but it's just not my thing. The first one is ice. People will ice it, it will reduce the pain. My natural inclination in general is to not ice an injury other than for reducing the pain, but for healing, I would rather not have ice. That's maybe kind of, I don't know, in my head, but my impression is that ice makes you feel better, but does not heal the problem. And that's true for this injury, but that's true for many other injuries. The last one is doing some foam rolling. Rolling your muscle can help. I'm just not someone who does that, but a lot of people swear by that and say that that's how they resolve their issues. So when should you worry? When should you think, wow, I mean, shin splint is just not getting away. Maybe you need to see a doctor. Again, I'm not a doctor. These are not medical advice. Don't sue me. But there are red flags that you should look for. And the first obvious one is if you do all of these things and it's not getting any better, you should consult. Just the fact that it's not improving by itself, consult because it could be something else. If you feel that the pain is very localized, like this is right here, and especially if you had a fall, for example, or something like that, could be a stress fracture, could be an actual fracture. Broken bone sounds like it's way worse than shin splint or a lot of different injury. And from experience, having broken quite a few bones, not necessarily. Sometimes a shin splint can be more painful than a broken bone, and you can't just like determine if it's a fracture or not just based on the level of pain. Technically, you can see your shin splint be swollen sometimes, so maybe the diagnostic is good, but personally, if you visually see inflammation, I would consult also. I would be worried it's something else, or in a case that it's a pretty severe case, and if it's a severe case, you won't be able to deal with it yourself. So that's where I would seek medical help and or a physiotherapist that can help you. And that's it. Injuries sucks, and shin splint in particularly really sucks because it specifically happened at the worst time always by definition. It's when you're increasing your volume or your intensity. It's when your workout are finally paying off, your training is going well, and it happens. Usually not so far from a race, and now you're worried. Should I just push through that? Should I push through the pain? The pain is not so bad right now, and I only have 4 weeks until my race. What I always say, and I have a lot of experience, guys, and I've raced some pretty good time. There is no question in my mind. It's better to come in a race healthy, injury-free, but under-trained because for 2-3 weeks you didn't train properly, rather than pushing your training because that's what it says, that's the mileage it says, and then you come in with an injury. If you come in with an injury, you will quickly realize that when people say, it's all in your head, it is not all in your head. If you have an injury and you need to push through that, first, it will definitely not be fun. Second, your performance will be severely affected. So the perfect training that you had coming in with an injury is actually ruining that. And that's where you need to understand that training are not always perfect, and that's okay. You did the best you could, and the best you can do right now is to be mature about it, take the rest, appropriate rest, so that you get rid of this issue rather than have it be recurring. Because that's also one of the reasons I think shin splints are so annoying. If you rest for 1 or 2 weeks, it can feel like you're 100% back. But as soon as you ramp up training again, it will come back. And it's not because that's your limit. It's because you were not fully healed. So you have to be careful. As always, thanks for watching. Thanks to all of my Patreon supporters. See you next time.